Welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is CeCe Dixon, and she's a trichologist.
Yes, ma'am.
Now, I've never talked to a trichologist before, but I'll break it down like this. You deal with hair care.
Absolutely. We deal with hair care. We kind of bridge the gap between dermatology and cosmetology. So your scalp, your skin, and your hair growth. That's what trichologists do.
Now, we know that hair, especially in the African-American community, it is a multi-billion-dollar business, from weaves to braids to getting your hair done, hair care products, hair vitamins, you name it. It is huge. It is a huge industry.
Absolutely, huge industry. And right now, we have a lot of our women are suffering from hair loss, and that's what's making the industry blow up as big as it is right now. And there's a lot of knowledge out there that people are missing, which are causing them to have bad hair care habits.
So what should you be doing to take care of your hair? And everybody has that question. What are the do's and don'ts? There's so many options out here nowadays. A lot of people are getting weaves, a lot of people are getting braids. There's also the move toward natural hair. What should you be doing to take care of your hair?
Well, regardless of what you choose, scalp care is the most important. Scalp care and your internal health. They kind of go hand in hand. One of the problems we're having with some of our styling is we're covering and we're smothering the scalp, and we're not able to keep it cleansed properly, and it's not able to breathe. So the follicles are getting smothered out, and that's why we're having, so much hair loss. So if no matter what style you choose to wear, as long as you keep that scalp cleansed and clarified, you should be okay.
How often should you wash your hair?
I don't think there is a particular amount. I don't think there's a such thing as too much washing, and you don't always have to wash. You can sometimes put a treatment or something on a cotton ball and just go in and dab the scalp to cleanse it, So it's not always necessarily a shampoo that you have to do, as long as you're keeping that scalp clean.
Now, the old knowledge, the old method of doing things, I was always told you shouldn't wash your hair too often. It should be more like once a week, because the natural oils that are needed for our hair to be cleansed and to grow. So if you wash it every day, you're taking away what we need.
Well, I think that depends on product use. I think that also depends on your internal health. There are many factors other than just, washing your hair. If you're active and you're sweating a lot, you need to get that salt out of your hair. So you have to wash more often if you're exercising or something like that. So I think it really depends on what's going on in each individual's life.
You made a connection between your overall health and the health of your scalp. So in other words, you may be taking care of your hair, but you got to take care of your body first.
You do. Like you could possibly, there are multiple dermatitis. You could have seborrheic dermatitis, seborrhea, psoriasis, eczema. Those things are dermatitis, and that's scalp issue. And scalp issue will impact the growth of your hair. It will certainly not grow healthy in those environments. So you have to control that scalp issue in order for your hair to be in its optimal condition. You can also have, high blood pressure, if you're on high blood pressure medications, or if you have autoimmune deficiencies like lupus or thyroid issues or Crohn's disease. Any of those type of autoimmunes will also impact your hair growth. The medication that you take for those things impacts your hair growth. And so, it's not just, you taking care of the hair itself.
So if you're on high blood pressure medication or thyroid medication, you could end up losing hair.
Yeah, most times that's a side effect, and a lot of people suffer with it. Your hair will start thinning. The texture of the hair will change. You'll get breakage. And so you have to be able to you have to have a professional eye that can identify that and be able to combat everything. It encompasses a lot in order to make a healthy strand of hair, right?
So what can you do if you're stuck taking diabetes medicine or high blood pressure medicine for the rest of your life? What can you do? Vitamins? I mean, what are some of the things you can do?
You can do vitamin supplements. We certainly need them. I have become a little skeptical about taking multivitamins because, you know, I just can't wrap my head around the concept of getting all of those vitamins in that tiny little capsule, especially as I make product and I realize how much I need, you know, in order for it to be effective in the product that I'm making. There's no way you can get all 20 of those items on that pill bottle in this tiny little capsule. So my preference is to take the individual, whatever you need individually, because you're certain to have the potency that you need in that serving.
What do you think about those the hair growth products, the minoxidil?
Yeah, minoxidil. Well, you know, minoxidil is funny because most of them, minoxidil was originally designed to be a blood pressure regulation. Yeah, a blood pressure regulator, and they determined, they saw that it caused hair growth. So they just repurposed it and now makes it a hair growth item. Most times when people take minoxidil, they do see hair growth. Some people also get a little lightheaded and sick because it's also altering your blood pressure. So if you don't need blood pressure medicine and you're now using minoxidil, you could, you know, have some side effects from that.
Once you grow hair, do you stop using it?
With minoxidil, you have to use it for the rest of your life. Once it starts growing, once you stop taking it, your hair is going to stop growing. So once you start, you can't stop.
And where will it grow hair?
It will grow hair anywhere it touches.
Wow.
Yeah, that's the thing about minoxidil, especially if you use it in a liquid form. Whatever piece of your skin it touches, you best believe a piece of hair is going to grow. It's awful.
What about the pill forms? I think it's Propecia.
I'm not familiar. I'm not sure about that. But you can use most times in the women we have what we call female pattern baldness.
Yes.
And we have it in men as well. So alopecia comes in different forms. You can have female pattern baldness, male pattern baldness, and with women, you know, as we age, our estrogen levels go down and our testosterone levels come up. And we find that the testosterone, we call that DHT, it attaches to certain receptacles. So if it attaches to your follicle receptacle at the top of your head, it will act as a sealing and prevent the hair from busting through, right?
Is that why you'll see men with a full, healthy-looking beard and a bald head?
Yeah, because it depends on where the receptacle's attached to. And so, yeah, you'll see women with almost a full beard and a bald head, right?
What can you do?
Well, you can do topical formulas that have what we call DHT blockers. And if you have a DHT blocker, you can apply that and it will block the testosterone and allow the hair to grow, right? So you put it in the affected area, you use it in a shampoo, in a conditioner, and an oil, but you just apply it topically where you want to block the DHT and you can get some hair growth.
Is that another thing that you have to use forever?
I don't think so. I think once you get, and you can't do that alone, you know. Growing hair, if you've had 10 years of hair loss, you can't expect to just have, you know, use a bottle of this miracle formula and all of a sudden you're going to have hair growth. That it's not going to work that way. But you can do a combination of things. You can have low-level light therapy, which is a red light therapy. You can have oxidation, O3 treatment. You can.
What is that?
It helps for blood circulation. It's like injecting oxygen into the scalp to help with blood circulation, because blood circulation is a major contributor for healthy growth, healthy hair growth. And that's why we have to make sure that our bodies, we have the proper nutrients, because if you have low iron, that affects how your blood circulation is as well, the oxygenation of the blood. So you really, there are multiple things that you have to do in a combination so that you can have a continuum of growth.
Some things are a catch-22 situation. I know that I've struggled with bald spots. And so you get a weave to cover over the bald spot, but the weave causes the bald spot to get bigger and bigger and bigger. But you got to cover the bald spot because it's not going to look good on TV.
Right.
So what do you do? How do you get out of that situation? And today's styles are not conducive to healthy hair.
Well, you know, I think if you catch it in the beginning, and your stylist is your first line of defense. If your stylist is in tune, your stylist can tell you that you're having an ailment probably before you can, because she can see it in your hair. You can see that the hair is brittle in a certain area. You can see that it's thinning in a certain area. And so we might be your first line of defense most of the time, but when you first see it, if you treat it, then you can fix it and you won't have it to worry about. You also can do styles that are conducive for camouflaging, like layers. Layers are the best way to cover thinning spots. You can't have your hair down to your back hanging long and you're thin in the top, because gravity makes the hair hang low, right? So if it's hanging low, you're going to see all that thinning area. But if you put layers in it, layers makes it light, airy, full, right? And then you can camouflage a lot better.
Do you think that the more natural styles, because we see everyone's moving, or a lot of women are moving toward more natural styles, do you find that more healthy for the hair? Now, I know my daughter went natural a couple of years ago, and she spends an incredible amount of time. You would think it's just kind of shake and go, but she spends an it's like a job.
Yes, yes, yes. Well, you know, natural can be real tricky. I think most times we see those images of what looks like a wash and go look. Well, that's actually a particular hair texture, right? If you don't have that hair texture, you're not going to get that curl pattern. So that's one thing about natural that we're misled by, but it's just a lack of information. We don't know, right? We just look, we see it, and we think our hair is going to do it, and we just dive right in, and it doesn't work that way. And I also think that in terms of relaxers versus natural, I don't have a preference one way or the other. I think if you have a professional that is knowledgeable and knows how to apply the relaxer properly, has addressed all of your scalp issues and things like that, you should not have an adverse effect with a relaxer. You don't have to be afraid of relaxer. I have a head full of blonde coloring in my hair, and I'm relaxed all day.
Well, how damaging is color to your hair?
Well, again, it all depends on your health, the health of your hair, and the knowledge that your stylist has, right? Again, I'm bleached. I'm bleached 3 times over, and I have a relaxer, and my hair is healthy. You know, all my clients' hair are healthy. I do have a restoration center, so for people that are having hair growth issues, perhaps I don't give them the chemical service that they're so desperately begging me for, because your hair is not ready for it. So you have to know when to hold them and know when to fold them, right?
And you know, we also see in the summertime a lot of people turn to braids.
Yeah.
And you would think that braids would be something that would protect your hair against damage. On the other hand, in a lot of instances, that's not the case.
No, I think, you know, too much of anything or too little of anything could still have a negative impact. I don't have a problem with braids, with weaves, with wigs, any of that. It's all in how you maintain and care for your scalp and the hair underneath. What happens is, though, I think once we start doing that, I think we get lazy and we just stop caring for them. Same way we do when we put on nail tips, right? You don't care anything about your nails because you have this acrylic on it anyway. It doesn't really matter, and you just totally neglect, right? So then when you take them off, your nails are brittle, they don't grow. So that's the same thing with the hair. It's the same thing. You have to maintain and manage the hair underneath, whatever you decide to do. And with braids, a lot of times, they just make them so tight that you lose your edges. People don't really necessarily lose hair in braiding as much unless you have a scalp issue that's going untreated. If you have a scalp issue that's going untreated, and most times that's what I'm finding is the case, most time you're having a dermatitis, you're having seborrhea, or psoriasis or eczema or something like that, and no one's identified that for you. No one's connected the dots for that in your hair, right? And because of that, you go in and put the braids in, and now you're still not cleansing your scalp as often as you should, or you're not treating your scalp with the proper medicine. Maybe it's tea tree, a cream, or oil, whatever you need to address the dermatitis. If you don't do that, I don't care what hairstyle you put in, you're gonna lose your hair.
Once for some people, I know with other people, you can regrow. But is there a certain point where there's really no hope?
Well, you know, depending on what type of alopecia, if you have, it depends on what alopecia it is as to whether or not you're going to be able to grow hair back. If you have scarring alopecia, you're not going to be able to grow hair back because it's as though the tissue has scarred over the follicle. You're not going to get any hair growth with that. But a certified trichologist will be able to scope you and take a look at your scalp and determine what type of alopecia you're dealing with. And from there, we can determine whether or not you can get your hair growth back.
Nowadays, too, they have surgeries that can put hair. Is that really your hair? How does that work?
Well, they're different things. They're different types. I don't get into the surgical piece of hair replacement, but you know, there's one thing where they take your blood and they kind of inject your own good cells into your scalp to help you grow your hair. Other times they take pieces of a section of your hair, you know, below your occipital bone perhaps, and they take that hair and then they re-implant that hair into your balding area.
Once that hair is implanted, can it grow? Or is that just that hair and that's the length it's going to be and that's it?
No, they say it grows. It grows. I mean, it's a very expensive process.
It sounds like it.
And sometimes it works and sometimes it doesn't, you know. I would imagine the same way if you were doing a organ transplant. Sometimes it takes, sometimes it doesn't, right? but they're obviously having success with it because lots of people are doing hair replacements.
Are wigs a way of letting the hair rest?
If you, everything in moderation is okay. And that goes for braids, weaves, wigs, all of it. A nice transition for someone that probably has hair loss and they're trying to get treated, what you could do is wear a wig to cover if your spot is so large that, you know, it's the only way we can cover it. But we treat it, you wear your wig, and as soon as you get home, you remove it so that your scalp can breathe, you can put your treatments on, things like that. But some people get wigs sewn on, right? If you get your wig sewn on or glued on, then that's the same as, you know, having the weave where you can't get access to the scalp. And it's the scalp that needs to be treated.
So in other words, no matter what you choose, the scalp has to breathe.
Yes. No matter what you choose, your scalp has to be treated. Your scalp has to breathe, and if you have a scalp issue, it has to be treated, right? So it doesn't matter if my scalp is breathing if I'm not treating the dermatitis that's affecting it, right? So I just think you just have to get the proper diagnosis, and then you can get your proper treatments in line, and then we can work on protective styles, because it's not so protective if you're losing your hair, right? And they call them protective styles. I'm like, what are you protecting? They're losing their hair. It's not protective if you're still losing your hair. It's only protective if you're keeping your hair intact, healthy, and cared for underneath. Then that's protecting.
Yeah, I mean, it's a very, since your hair, as they used to say, your hair is your crowning glory. Yeah. Yeah. So when you're losing your hair, it's a very distressing.
It is, and women, you know, their self-esteem, they lose their self-esteem, their self-worth, their self-value, and I believe that, again, if you get with someone that can diagnose you properly and get you back into, and give you hope again. I mean, I love when my women come in and I diagnose, we start our treatment plans, and as they see little tiny hairs starting to grow, I mean, they just light up. I mean, it just gives them new life. And
do the tiny hairs ever result in a full head of hair again?
Absolutely, absolutely. And again, it depends on why you had your hair loss in the first place, how fast it will occur. I've seen as quickly as 2 weeks, 6 weeks. I have one client that's been on my treatment plan now for almost a year, and she's full everywhere now. Yeah, so it does work. You just have to be consistent.
Does age make a difference? Because I know if you're going through menopause, perimenopause, or whatever, that can also be a cause of hair loss. Do you find more success with a younger group?
Again, I don't think the age really matters. It's more about your internal health that really matters.
And let's please emphasize that as we, you know, move toward the end of the show. Please emphasize the fact that it is overall health.
Overall health. And a lot of times we have ailments, and I don't know if we're even aware that we have them, or perhaps we have them and we just don't correlate them to our hair loss. And so when you come in, a part of your consultation is, I need some blood work. I need to know, you know, what medications you're on. We have to do a whole write-up to figure out what's going on in your internal health, so I'll know if I'm, you know, fighting an uphill battle or not. Stress is another.
Yes, stress is please, and so many people, you know, they're working long hours, they're working high pressure jobs.
Yeah.
And they don't realize how much stress impacts not just that, but your overall health.
Your overall health. And hydration is a major issue as well. And some of these things we know, maybe we just don't think the impact is as significant as it is. But, you know, I think our people perish for a lack of knowledge, and knowledge is key.
What about heat? Putting a certain amount of heat on your hair, is it something that it's okay daily as long as you're taking care of things, or should you watch the heat, the hot curler?
Yeah, well, you know, I think, well, what I know is heat can be damaging. It can be damaging if you use too high of a temperature. It will fry the hair. It will break the bonds. You'll get breakage.
Also, are perms the devil now? Because everybody is demonized. Back in the day, everybody had a perm.
Right.
But perms have really been demonized. As we wrap up the show, please, the perms are not evil.
No, they are not evil. Relaxers are your friend. Relaxers are your friend. So you have a relaxer system, and then you have a permanent wave system. So those are two different things, and a lot of times we call it a perm. It's not a perm. A perm is like your wave nouveau. That's a permanent curl, right? Your jerry curl, things like that. The relaxer system is what we use to relax the curl. You don't have to make your relaxer bone straight. You know, you need to leave some texture in your hair, right? If you leave some texture, you're bound to come out with a more healthy product afterwards, you know, a more healthy result. But no, relaxers are not the devil. In the summertime, you're gonna wish you had a relaxer.
Or you're gonna spend, like I said, 2-3 hours, or you're just an extraordinary amount of time on your hair when you can do other things that will allow your life to be a lot more simple.
I agree wholeheartedly. But whatever you choose, just make sure that you keep your scalp in a healthy, clean condition, so that the hair, because I liken it to soil, right? Soil and grass and flowers. If the soil is healthy, then the grass that grows from it is green, right?
Very good. That's very good advice as we wrap up the show. And again, we're talking to CeCe Dixon. She is a trichologist.
Yes.
And that's dealing with scalp care, care for the scalp.
Absolutely.
And you have to care for the scalp in order to have healthy hair. And of course, as we mentioned, you have to care for your entire body, including water, nutrition, vitamins.
Absolutely.
The whole 9 yards. You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.